Thank you, Dr. Thompson, for setting the stage so that we can really think about what lies ahead if we are responsible for that healthcare workforce development. To all of my friends that I've met and I've collaborated with for the last year and a half, welcome, and it's good to see you. For those of you who don't know me yet, my name is Dr. Leslie Sizemore. I am the Assistant Vice President for Workforce at the Council of Post-Secondary Education. So much of our work to this point has been on really looking at the healthcare sector because that is the preeminent need for Kentucky. And I'm going to share with you some slides today about where our work began and where we are headed. I'm also going to share with you some data points related to enrollment and what we're seeing. That's preliminary data for the state. So, this is a little slide that shows us a little bit of information about where we started. So our work did begin with that $10 million that was granted from the General Assembly to really spur innovation in the state in our higher education institutions. We have earmarked $8 million of that to go directly to the institutions who are responsible for putting out that product, that healthcare professional. And to this point, we've had about $4 million of that drawn down. We're right in the middle of that process. We're about 15 months into the program, and as Dr. Thompson reflected, we do have 48 partners. Thank you all so much, you industry partners, for stepping up to the table and really putting skin in the game. We now have about $50 million in-kind donations for this process, and really that's the critical part of the work, is that now we have people coming to the table that understand that they are also responsible for the process. It's not only the problem of the healthcare institution, the healthcare programs to really develop someone who is ready for this job and right for the job, but it's also a responsibility of the institutions. We've had about 6 collaborative meetings to date. And last night we had a great meeting. There's never enough time for us to really have all the conversation that we want to have to look at the problems, but I take notes voraciously through those meetings about the comments that each of you have given to spur thinking about how can we look at that pothole and see it as an opportunity. So our work is continuing through things like House Bill 200. House Bill 200 created the Healthcare Workforce Investment Program. And this bill allowed us to really look at that healthcare shortage. You know, we still have that data didn't change that was in the Courier Journal when we just started that said we need 16,000 nurses, more nurses by 2024. That hasn't changed. We still need those. And our turnover in Kentucky for workforce is 24.5%. Is that not incredible? You know, people are leaving the field of healthcare in alarming rates. So we need to figure out how to get those people content with where they are and how to make sure that we're getting the right people to the table, because that's a really big part of it, is that we're struggling at times to make sure that there's a match between that person and the job that they're doing. So CPE is charged with the Healthcare Workforce Investment Fund to make sure that those funds are going where they need to go. So we're going to establish a steering committee. Michaela Manier is going to be responsible for getting the right people to the table to help us make those decisions about where these dollars need to go. We will have 65% of that fund in scholarship money. That's a public-private match. It's going to be matched dollar for dollar. And so 65% of the fund will go directly to scholarships for 14 frontline healthcare workforce sectors. And 35% of the fund will be incentive funds that will produce some additional money to those exemplary programs so that they can buy more technology, they can recruit more faculty, they can really guide their programs and how they'd like to see them go. And at this point, we've got about $10 million that our industry partners have verbally pledged will be going into that fund. So we're really excited about that work. So this is the first slide I'll share with you related to some enrollment data. Now this is preliminary data. We don't have all the drop-in ads at this point and all of the specifics, but it gives us a pretty good idea of where we are. You know, enrollment by and large across the nation in higher education institutions is down. For Kentucky, we do have a little bit of an increase in enrollment, but what we see in the healthcare sector is that our increase in enrollment is even greater. So we do have some success with seeing more people enroll in healthcare programs. This is a little bit deceiving, and Dr. Thompson and I talked about this last night. It shows that our overall enrollment for health-related programs is down by 3.6%, but in fact, that's heavily weighted by a loss of 13% of people who are not going into graduate degrees or not enrolling in graduate programs. Now, those graduate programs are important because that's where we get our higher level degrees in healthcare. However, our undergraduate level enrollment is up by 3.7%. But the thing that's really amazing to me is look at that certificate level. These are certificate level programs increased by 139% in our state. That's really, really incredible. And what that tells us is that there are people who are probably would have never thought they could be successful with higher education before. And they're coming into the higher education institutions, getting a short-term certificate and going to work. So now that they're in those hospital settings and those healthcare settings, they can get the support of their employer to go back to school if they're interested and really step up their career and take a step forward with their successes, with being able to go toward maybe an LPN, which might lead them to an RN, which maybe would lead them to a nurse practitioner status. So this is the opportunity that we see when we get people at the certificate level going in. Our associate level increase is at 9.5%. And so we see with this population, we do have a little bit of a baccalaureate level drop. However, if you look at our underrepresented minority students, we have even more to celebrate. So you see that that baccalaureate level for this population of student is actually increased by 8.5%. Look at the certificate level here, 156.6%. That's incredible of the increase that we're seeing there. And overall, the enrollment of these students is up by 3.7%. Our undergrad is over 10%, so we're really excited about the beginnings of the increases in the healthcare sector enrollment that we see. So if you're thinking about some of the takeaways for the preliminary enrollment data, we are excited about those short-term certificates. We know that we're seeing more folks who are in the underrepresented minority groups enrolling in healthcare careers and healthcare programs. But we can see that that graduate program has really negatively affected our overall enrollment. Now, I will say, Michaela and I dug into those numbers to see really where that graduate loss is, and that is in the area of nursing. And so what you see is that nurses are making really good money right now. So they are in the hospitals working. They are content with their jobs. They don't see a need to really advance themselves to get that graduate degree at this time because all of that is driven by financial need for the most part. And so the economy is doing much better. So Ryan Kaffenberger helped me to understand that a lot of the school enrollment is counter-cyclical, and that means that during recession, enrollment increases while we're in economic expansion, enrollment decreases. So oftentimes you will see that. Now, some of the things we need to keep our heads up about is that most people who are in healthcare careers are female. And so there's always a child care factor that goes into that thought process. So right now, because of the pandemic, we've had a lot of extra support for child care dollars. So people have flooded back into the workforce because it made more sense for them financially to go back to work and to allow someone else to care for their children. But as those support dollars decrease, as those go down, we will see likely that some people will have to make that decision about whether or not they go home. So our industry partners are going to have to really think about creative ways that they can help people with that child care issue to keep people working. Now, I want to talk to you a little bit about our phase 2 of the Healthcare Workforce Collaborative, and that is a focus on mental and behavioral workforce development. So Dr. Thompson alluded a little bit to this, and so our first work was really to look at physical health workforce, frontline healthcare workforce. And now we're looking at mental and behavioral health workforce. So I wanted to talk with you about CLIMB, and that is our first initiative under Phase 2, and that stands for Career Ladders and Mental and Behavioral Health. This is a project largely owned by Carl Wilson, who is with us today, and he's just been incredibly creative with bringing folks to the table who have a past of recovery and reentry. So these people have life experience with substance use disorder, and they are seeking employment as peer specialists and will have these post-secondary pathways that will enable them to really grow into career development. This project was funded through the Cabinet for Health and Family Services. We will be celebrating Secretary Friedlander today because he was very encouraging to us and supportive through this process. And he understands that this problem isn't going away. We're going to help people to maintain sobriety. And one of the best ways to maintain sobriety is to be best fitted to the workforce, to be able to contribute to society and work a job that people find rewarding and is financially feasible for their families. We do have 9 of our colleges who are participating partners in CLIMB, and we are excited about this project. The next project that we are just starting to dive into is the Thrive Project. Now, this stands for Training and Healthcare Recruitment for Immigrant Vocational Education. And we are focusing on the need of long-term care with this. So one of the largest industries that has not really recovered since COVID for their employment capabilities is long-term care. And as we see federal laws that are coming down that may indicate that we have a particular ratio of caregiver to patient, many of these healthcare institutions will likely close if they don't get some support. So we are looking at the ability to assist people who are immigrants in the state of Kentucky to be able to get the ESL services that they need and the translation services that they need, and that'll likely be through AI and technology use, and getting them into those working arrangements. So we know that we'll be able to assist them with support services, wraparound services that would enable them to get this short-term credential. Again, when they get into those long-term care facilities, the hope is that they will have pathways that will enable them to take the next step forward into a lifelong career in healthcare for Kentucky. So we're really excited to see where this initiative goes. My next area of interest is this partnership between University of Kentucky, University of Louisville, AHEC, and the Cabinet for Health and Family Services to be able to look at an integrated care delivery system. So one of the areas that we see is this lack of physician workforce that's available throughout the state. So it's not only that we don't have enough physicians in the state of Kentucky, but we particularly don't have enough physicians that are dedicated and specialized in mental and behavioral health. We do not have enough psychiatrists. We do not have enough people who are managing the health care of people who are affected with mental and behavioral health illness and disease. So we are hoping to be able to start a process that will effectively skill up primary care physicians, your nurse practitioners who are taking care of your general health concerns, to be able to skill them up to be more advanced with their comfort level and ability to manage their patients' mental and behavioral health care needs. So if you have a trusted relationship with your primary care provider, it may be through this process that that provider would be competent in that area of mental and behavioral health to be able to take care of you along those processes. So we do have some interesting things that are moving forward. We're really excited about those, and I think we have about 5 minutes or so. If you all had any questions, I would be glad to entertain those. Let's see if there are any questions. Yes.
Sizemore, with the drop in graduates seeking candidates, what can you directly attribute that to?
Well, a lot of that is the economy, because when people seek out graduate level education, it's usually so that they can better themselves in their careers. So it's likely the fact that people are making enough money at this point and pretty comfortable with their economic stability and their economic development in their area, their chosen career, that they don't feel like that they have to step into that next graduate level career path. Yes.
I have a question about House Bill 200.
Yes.
So we're from Northern Kentucky, and does the institution have to be Kentucky, the healthcare partner, does it have to be a Kentucky-based partner, or is it okay if they have offices or centers in Northern Kentucky, and would you be willing to partner?
That has been a common question, and we're still fleshing that out a little bit. But I think that the healthcare partner does need to have at least some allegiance to Kentucky. The more of the important point is that the student is a Kentucky resident. So we want to make sure that we capture that student and keep them in Kentucky. So that's more of the important aspect. I think that the statute itself doesn't say it cannot be someone from out of state, or a program from out of state, but we are working on that, and that would be clarified more when we do our webinar that actually talks about the process. Travis Powell, are you in the room? There he is. Michaela, why don't you go back and let Travis address that question?
Yeah, so I'm Travis Powell, Vice President General Counsel at CPE, and actually I'm going to testify on that reg today for the Reg Review Subcommittee here at 1 o'clock. But no, the program does not need to necessarily be a Kentucky provider. That would not make, if they weren't, they wouldn't be ineligible. As Leslie said, they would need to be, the scholarships do need to be for Kentucky residents, and then their service requirements need to be completed in Kentucky. But the actual program provider does not necessarily need to be a Kentucky institution. Now, need to meet the requirements to be able to operate in Kentucky, and the credential that they receive, you'll need to be able to be licensed in Kentucky in that credential, but it doesn't necessarily need to be a Kentucky-based provider to be eligible. Now, we'll see as we go through the process and decide, determine how much money we receive in the fund, and how those funds will be allocated. There could potentially be preferences, Leslie, for Kentucky-based institutions. We haven't decided. That's what the steering committee would take a look at. So that's a possibility, but if you're an out-of-state provider, it would not mean you were ineligible. You would still be eligible. So.
Thank you, Travis.
You're welcome.
Any other questions? Oh, yeah, that's a great idea. If you are a vice president, staff member of the Council on Post-Secondary Education, would you please stand? Would love to recognize you. Thank you all.
Hey, just a quick question.
Sure.
Dylan Baker with Appalachian Regional Healthcare. So with childcare continuing to be an issue, is there anything that you're seeing in the state that employers have done to be very innovative and creative to help address that childcare shortage? Any insight on what some other folks are doing in the state, if anything?
I don't have particular examples, but I know that is on the radar of our legislative leaders. I know that we are working with our industry partners to be able to, link them up with the supports that they might need. We see a lot of innovation around child care supports right at the industry and hospital level. So a lot of hospitals are diving into their own daycares and things like that. So that's likely one of the areas that we'll see. Dr. Thompson?
They told me to turn it on. They should know better than to tell me to do something. Yeah, great question. And let me tell you what we are doing at CPE along with Secretary Eric Friedlander and his unit. We've done this work on basic needs. You may have seen it. And he is investing what they call the Kentucky connectors. That would be all around the state to look at the basic needs of all of those who are wanting to go to college to go into a particular field, especially healthcare, and that would try to address some of the child care issues. But just to let you know, this is one of the biggest issues that we have in Kentucky as a whole. We've lost about 60,000 adult learners. And let me just tell you, COVID exacerbated that, especially with women, honestly, and child care. And so these are the potholes, once again, that we already had, but they got bigger. So that's actually an excellent question. But we are working on it, yes.